This is Dennis Williams from Money Talk Viewpoint Post. We are just thrilled to have you join us today. And I wanted to start off right off the bat by introducing to you our special guest, which is Mary Elaine Petrucci. Well, what you're saying just seems so reasonable and
Mm-hmm.
logical, but obviously for your business in which you're serving as an advocate, you're also saying that people really struggle creating boundaries. And so kind of what causes them, what's the cause of the struggle? And I'm assuming here that which you can address is you're coaching them to learn how to set boundaries. Is that kind of what you do, or are you telling them that they need to put it and then you're done?
That's a great question. So first of all, yes, I can coach people, caregivers in the sandwich generation, to understand the importance of boundaries and how they should set them with each individual that they're really close to. Yes, I can do that. I can do other things to help them reduce their stress and overwhelm and burnout. Before we get to that, I like to address your first question, which is why people don't set boundaries. And it's all centered around fear of angering other people, disappointing them, being looked at as being difficult or selfish, that you're being mean or that you're ruining a relationship. And none of that is really true. By setting boundaries, you are letting people know that they have to treat you in a specific way in order for you to give back what you need, the other person needs. So if you're caring for someone, I know it may sound nonsensical or contradictory, but if a person has dementia and they're having a behavior problem, it has nothing to do with that person giving care. It's having that caregiver think about, okay, that person is having a behavior problem. What can I do to better serve that person, to reduce their stress and agitation, so that I can give them what they need? That's one scenario. Or if somebody's being really abusive and about everything you do and saying that you can't do this, you don't do this right, you don't do that right, I want it now, I want it this way. Well, you need to set a boundary and say, look, I want to help, but this is what I can and will do for you. I can help you if you're going to be really abusive and tell me what I do or don't do. I'll tell you what I can do for you at this particular moment. Is that efficient enough for you? So you're doing some negotiation, so it's a win-win situation for both sides. But the minute you start setting those boundaries, people, after 2 or 3 times, they're going to get the message that they have to respect your boundaries so that they can get to have you do something for them, if that makes sense.
Yeah, it does. And I guess the challenge that people have, I would think, if they haven't done it on their own already,
Mm-hmm.
is some sense of them thinking that they're not being a good person. Is that a safe assumption to make?
Yes. Caregiving is a very challenging role. And I've done it and I understand what caregivers go through. Yes. What I'm suggesting is we need to help I need to help. Caregivers change their strategies and their limiting beliefs and negative emotions so they can be more effective in serving their loved one. I mean, we're all doing most of, our conscious mind is running our life like 95 to 98% of the time. And we're playing tapes, old tapes in our head over and over again. And it's not serving us now. Those are tapes that we incorporated from birth to 7. So I'm suggesting that by looking at your own life and the minute you change your life, it will make an impact on others.
So this process of setting boundaries, how long